let's get the party started. Hi, everyone. Today's session is brought to you by Advanced eClinical Training, who provides online healthcare training and medical certification programs. Our speaker today, we have the honor to have Dr. Alexander Moore, who's an associate professor in environmental health at University of Massachusetts, Boston, and assistant research professor at Climate Change Institute and a group leader at Harvard University. Dr. Moore's research focuses on the impacts of climate change on population and ecosystem health and the economy. He has authored several landmark studies on the impact of climate on pandemics and pollution, and has been an active contributor to fields of environmental health, health economics, sustainability, and planetary health. Today, Dr. Moore is going to be sharing to us his perspective on this topic that we usually take for granted and thus overlook, how public health is in fact deeply connected with climate studies. Please let us welcome Dr. Moore.
Thank you. Thank you for having me. I'm thrilled to be speaking to the pre-health community. I was myself a pre-health major in college, so I want to say hi to all of you as you are embarking on the same journey. My journey took a couple of side routes, but eventually returned to public health. I also served in the U.S. Senate for the Affordable Care Act under Senator Kennedy, and also taught for a long time at Harvard in various departments. But I'm still at heart premed. I still have that mentality. So I'm very much empathize with all of you and all of the hard work you have to do to go through that. And I've advised students as a director of an honors college and a chair of a public health department for 3 years so lots of pre-med students. So please feel free to ask those questions. I'm always happy to chat about your pre-health careers. So let me start by, let's see if I can do this by sharing my desktop.
Yep.
And then clicking play, and it should be all good. Can you see that?
Yep, there we go.
Awesome. Okay, except I can't see my mouse to minimize the zoom. So 1 second. There you go. Okay, so we're going to talk about how the future will change as a result of climate change, and your education will change, and how we do healthcare will change, and how do we do research. You all are in Arizona. This is the map of what it feels like out there today. It's not a very encouraging map, but the encouraging part of it, I guess, is that everywhere else in the US is not very different. And I think this is a heat index map. A heat index is not just what the temperature is outside, but how that temperature relates to humidity. And when both temperature and humidity go up, you're in big trouble because you can't sweat as fast. And the likelihood is that the likelihood of a heat stroke is much higher. And I think this is we could have the whole talk basically just with this map today, because you all are aware of what the temperatures are out there, and you're aware that these are life-threatening temperatures. And this map shows you how much of the country is affected by climate change and these new temperatures, this new abnormal, and how we will have to, in the healthcare field, really deal with a climate crisis and a heat crisis that is unprecedented. Interestingly, heat strokes and heat-related deaths and injuries are some of the most underdiagnosed in the world, and particularly in the United States. But these graphs, there isn't a whole lot of data on it, as you probably heard from the news. There isn't even legislation to protect workers from heat-related injuries. But we do know, as you would expect, that infants and the elderly are way more affected by heat than others. And obviously, minorities are also way more affected by heat than others, by extreme heat. And that is usually because these populations have less access to ways to be to shield themselves from heat or climate change, for that matter. Climate change brings also severe weather of other kinds. And this is what you can expect the United States to look like in the next 30 years, where we see, anything orange and above is going to have basically half of the year above 90 degrees if all emissions remain the same. That is, if we continue to pump CO2 and other greenhouse gases into the atmosphere. That is significant. There are only going to be very few places in the United States where 90-degree weather, where you can only be about 15 to 30 minutes outside without significant health issues. There are going to be very few regions where that is the case. By the numbers, 70% of heat-related deaths occurred so far in patients with a cardiovascular condition. As you all know, cardiovascular disease is the number one killer in the United States. So basically, everybody is susceptible, almost everybody. And of course, most of the U.S. population is in urban areas, and urban areas become heat islands. That is, they don't dissipate the heat. They can't become cooler fast as coastal areas or forested areas. That's why it's important to keep green spaces in urban areas, because trees actually allow for that temperature to drop significantly. Not only with shade, but also with chemicals released by the trees themselves that allow for temperatures to drop. And I'm not going to go into the details of that. But most deaths actually occur in Arizona, where you all are, Texas, and California. And as I said, there are some of the most underdiagnosed deaths and heat-related diseases or conditions. This is like a testimonial that comes from the National Weather Service, somebody Lake Tahoe, who just went on a hike for 10 miles and basically had heat stroke. Walking without water in 100 degrees heat, not a good idea. Splitting headache is the sign of a heat stroke. You want to go to the hospital or an emergency room if you have that. Obviously, this is a massive public health crisis for unhoused Americans and immigrants who don't have access to shelter during the hot months of the summer, and particularly in those states that I mentioned earlier. And of course, it affects animals as well as people. And this is important, not just because we love our animals, but also because there are animals in the wild as well as in our houses. And those animals are being affected by the heat, and they're changing their behavior accordingly. And as they change their behavior, they will actually change our health too. So imagine that this is the map of what you're seeing right now. No, don't imagine it. This is in fact the temperature out there. And imagine that you're in the forest, or in the desert, or in any wilderness habitat, and you're an animal and you want to escape the heat. So you want to fly northeast if you're a bird, or northwest if you're a bird, or you want to migrate. You want to just walk your way out of this mess. And that is what we're seeing constantly in the United States, right? There are migrations around us all the time. Birds are blue, mammals are pink. As animals migrate as a result of climate change, as a result of extreme heat or other extreme weather, they bring with them diseases that are not endemic of the new areas where they are. Endemic means they are not present in the new areas where they are. Malaria is one of them. mosquitoes carrying malaria are coming north. The malaria parasite is actually being found now in Florida, several cases, as you probably have heard on the news. But, you can think of bats, you can think of deer, you can think of any animals that we've had a bear going up and down the Massachusetts coast this summer. Black bear, not very common on the coast. Okay, probably not carrying anything particularly dangerous, but these new phenomena are going to happen, and they're going to happen more as extreme weather occurs, and we're going to see different species migrate. And even they don't have to be as big as a bear. Mosquitoes enough to change your life, and so is a tick. So this map that you see here is a temperature anomaly. That is how much hotter it has been in Northeast compared to 30 years prior. And if you overlap a map of Lyme disease cases, you can almost draw a line at the 3-degree difference, where essentially we doubled the length of the summer, and therefore how much time ticks have to reproduce, and therefore how much time they have to bite people. We also removed the top predators for deer. Therefore, there's a lot of deer out in the wilderness. In upstate New York, they're more common than rats. And, deer ticks are the main carriers of Lyme disease. Interestingly, they don't only carry Lyme disease, they carry several other even more dangerous diseases, fairly fatal diseases that we don't really talk about all that much. Lyme is the most common one, but Lyme can be essentially treated with antibiotics. Most of the others cannot be treated very quickly, and Lyme can be sort of prevented if you find a tick right after a hike. You can probably pull it off before it actually bites you or infects you. But this is the change in cases. We used to have no cases at all, particularly in the Midwest, but this change has occurred in the last 20 years or so. And we can only expect it to go higher because, of course, there are no top predators for the deer, and we have lengthened the length of the summer, in fact, doubled it. And the winters are not freezing anymore, so the larvae for ticks are not dying. So to understand all of these things, you have to be not just a public health person, but also an ecologist and a climate scientist, and that's why public health is fun. This is the last scary slide, I guess, about how the 2 species of mosquitoes that carry all those diseases in the bottom, dengue fever, chikungunya, Zika, are actually now reaching as far as Maine. They didn't used to, and now they are, due to, again, increasing temperatures and humidity that allow them to live in a habitat as strange as New England for them. It's no longer strange because we've changed the climate, and therefore the habitat is okay for them. So this is, I guess, this was an assessment of where we are, but here's a bigger picture of what we can expect in terms of crises in the future. If you look at time as a line, time can be separated in sections of warmer and colder periods that naturally occur due to natural changes. El Nino, we are just experiencing this heat because of El Nino change that's only been worsened by man-made climate change. But in the last 50 years or so, we've really experienced the effects of climate change. Interestingly, at the transition periods of all of these changes, there have been major pandemics. And this is what I work on particularly. And why the transition periods? It's because those animals and people who live in certain areas start to migrate and change how they live. And as they do, they bring their disease environment with them. A special case of this was the largest pandemic by number of victims, the Spanish flu. of 1917 to 1920. I discovered a climate anomaly that lasted 6 years over Europe in that period that basically changed the pattern, the behavior of their main vectors, of the main vector of the Spanish flu, which is birds, and essentially was a spark for the largest pandemic ever to occur. And you can just see how that climate anomaly with lots of rain correlates with deaths during the pandemic, particularly right at in the fall of 1918, when we had the largest wave of deaths. The red are deaths and the blue is rain, and you can see the double peak there correlating. So quite remarkable. Just by comparison, the Spanish flu was 50 million dead, 1/3 of the population of the world died. COVID was 7 million dead, and about 12% of the population infected. Sorry, it was infected before. 1/3 of the population infected, only 12% for COVID. So Spanish flu was much more deadly, and we can expect that as a possibility for the future. This research is becoming very, very current. As you can see, the coverage we received, and it's skyrocketing to top 5% of all research ever published. So it's quite current. You can get funded fairly easily from NIH and NSF. And the hard part of it is that you have to think really interdisciplinarily, and that's really, I guess, the message for you all, where you are in, an undergraduate programs and getting ready to go to medical school or nursing, or are in nursing school, or want to go to public health for grad school. And we, unfortunately, most of these disciplines think linearly in cause and effect, and we don't really think multidisciplinarily about how many things in the climate, how many things in the environment can really make a crisis occur or a disease occur. And as public health people, we think in terms of population rather than one single patient. We think in terms of context, large nature context. So in fact, reality has lots of causes, which then create an effect, and you've got to be trained in that. You have to be trained in all of those disciplines that, or at least familiar with all those disciplines that create those causes and create that effect. So concurrently, you have to also be very aware that a lot of this information, a lot of the information that is being given about this stuff online and through media is inaccurate. We're getting a lot of news about climate and health, and especially during the pandemic, we really noticed how most of the accuracy about this stuff has declined. Are masks good or bad? It took us a year to figure out if the answer to that. Most people still don't know. And you can say the same thing about most questions about climate. But the attention is there. The attention is increasing. As all of these graphs show, attention to these topics is increasing, and it's increasing exponentially. So that means that you can really make a career of researching this stuff, and you'll be well funded, and you'll always have a question to answer. But it also means that you're fighting misinformation, disinformation sometimes. How are you going to get trained in all of this? There are programs that basically are alliances of schools of medicine, schools of public health, schools of nursing, schools of healthcare, essentially, out there that are trying to implement courses, adding curriculum, new courses basically to your requirements in environmental health and climate and health. And it's happening, but it's happening very slowly. This is one of the initiatives at Columbia. It's moved very, very slowly, hasn't really been adopted. Same for Planetary Health Alliance, which is from Harvard and soon to be at Johns Hopkins, and which I am part also. And people keep publishing about this stuff, but in fact, it hasn't been implemented yet. So my take-home message, besides thinking interdisciplinarily and being eager to explore different sciences at the same time, not being afraid of doing that, is to actually start looking for those courses in your undergraduate days that can prepare you in environmental health, climate and health. I teach several of those at UMass Boston. I've taught them at Long Island University, NYU, Harvard. And I'm always happy to help if you would like to look for some, or if you would like to think about what programs are stronger in this particular type of training. So with that, I hope that all that was interesting to you. That was about 20 minutes since we started, and I'm happy to take your questions.
Great. Thank you so much, Dr. Moore. That was actually, yeah, really insightful. Because like, honestly, as pre-health students, I'm sure that like there are a lot of like trainings and requirements. You need to do clinical hours. You need to do extracurricular activities. Yeah, many few of us are actually really, I'm gonna be frankly here, like aware of like how important this field is, really.
Yeah.
So yeah, really thank you so much for speaking at our conference and providing that unique perspective and this rather kind of like overlooked field by pre-health students. So yeah, let's just dive into our questions. So Annie is asking here like, how could there be no Lyme in Florida?
How could there be no what?
Oh, Lyme disease.
Oh, so Lyme disease is a bacterium that lives in the gut of ticks, and it just hasn't spread down there yet. But if some crazy deer decided to move to Florida that was infected or carried infected ticks, the migration goes north, not south, because the deer aren't crazy and don't move to Florida where the temperature is 114 degrees. They want cooler temperatures. So the likelihood is that it'll spread to Quebec and Nova Scotia and farther into the Pacific Northwest, but not as likely to go to Florida, simply because, unlike humans, wild animals have realized that Florida is not a good place to live.
Okay. Yeah, thanks. I guess like next question, one of our attendees asking like why, what made you interested in public health? And I guess like in addition to that, do you have any kind of like light bulb moments for you that you want to like talk about?
Sure. So what got me interested in public health? A couple things. First thing is, you can be a public health scientist without necessarily having the party card of a public health PhD or an MPH. I've just hired a sociologist in my department of public health. She does amazing work on migration of people as a result of climate change in South Africa. She's a sociologist. She's not an MPH. She doesn't have an MPH, Master of Public Health, or a PhD in public health, but she's an amazing public health researcher. So what I always loved about public health is that it's a very equal opportunity. It will recognize the value of your research, no matter what your training is. This is true of also the funding agencies. So I really like the interdisciplinary aspect of public health, and how you can basically bring in together whatever you'd like, whatever data you think is relevant. And most other disciplines, most other sciences, including medical science, don't really do that. People who are trained in the other sciences don't really tend to be very familiar or comfortable going outside of their training out of their discipline to understand the interaction of multiple factors that can create the reality that you're looking at. But as I said before, reality is interdisciplinary. And consilience, this is a very important concept. Consilience is the independent agreement of independent data sets to form a reality, right? So multiple data sets that corroborate each other to prove that what you're looking at is not biased, because if multiple independent data sets show you the same thing, the bias sort of disappears. This was a concept that really was championed by Ed Wilson at Harvard, who was an ecologist. Didn't really have anything to do with public health, but I was very lucky to interact with him when I was at Harvard, and he taught me a lot. And it really teaches you to be a very interdisciplinary scientist, a very open-minded person, which is really important. So that's number one. I think public health is one of the best places to be a scientist, because you can really be as open-minded as you can get. The second thing is that when I came here to the United States, I came from Europe as an immigrant. And in Europe, pretty much every country has universal healthcare. When I came here, it was sort of a culture shock to see that most people didn't have universal healthcare, didn't have healthcare at all. Most states didn't have it. Massachusetts had it late, and more recently, but I went to undergrad at Washington University in St. Louis, which happens to be close to a free hospital called the Shriners Hospital. And that's a free hospital for burn and orthopedic victims. And I noticed that people would travel from all over the South to St. Louis, Missouri to be cared for, to take their kids there. It's for kids. It's a children's hospital. And it was just, a kind of a come to Jesus moment where I realized I didn't want to really be part of a medical system that wasn't equal for everybody. I wanted to fix that, but I didn't want to really, be in the position of having to deny care because a patient doesn't have insurance, or not give as good a care because the patient doesn't have insurance. That's just goes against my ethics. I don't agree with it. Also, I just don't like the system as it is, and that's why I went to work for Senator Kennedy when he was writing the Affordable Care Act. The third reason, I think, is more egomaniacal, I suppose, but I think everybody here wants to have an incentive, a fire under you when you get up in the morning, right? I don't know about you all, but I want what I want to do with my day and limited time on this planet is to really change things for the better for as many people as possible. And that was why I wanted to be in medicine, right? I think all of you want to be in medicine because you'd like to help people. I wanted to do the same. My grandfather was a physician. My grandmother was a nurse. They raised me. And so it was really in my ethos, it was in my personality to want to help people. And I was not satisfied with helping one patient at a time. It wasn't enough. And I also was not satisfied with pure research where you just, publish your couple of papers a year and they end up behind some paywall or in a dusty shelf somewhere. At the end, if a bus hits me tomorrow, in the last 30 seconds, can I really say, hey, I spent my years on this earth actually doing something that helped people, and, I published 5 papers that nobody ever read. I don't know, there are different personalities out there. Personally, I want to affect as many people as possible. So public health is medicine by population. So instead of having one patient at a time, you have millions of people at a time. We don't wear white coats. We don't, wear stethoscopes, but we essentially inform politicians, policymakers, stakeholders, people, communities, media, to basically tell people what to do and prevent illness from happening. So by and large, the impact of a public health person is in the millions. And I just feel that that's incredible. That's a great feeling to have. You see your research on the news. Doesn't matter if they don't mention you, which most cases they don't, but it's having an impact. Don't you want to have an impact? That's why. Long answer.
Yeah. No, that was honestly a very interesting journey that you had. But actually that enlightens us, which is like in addition to actually pursue a career as a physician, actually, like honestly, you can also pursue hands-on impact on your patients or those who are suffering from illness as a public health like scientist or anything in that field of like career. So yeah, definitely something to ponder on.
Yeah.
It's like, yeah. One of our other attendees had a question. Was like, what are some projects that the US is working on to control the extreme increase in the climate change, and how successful, to your opinion, can they be?
That the United States is working on
The United States, yes.
as a government. Well, the administration just passed the most comprehensive law that addresses a lot of puts a lot of funding behind a lot of the problems that we need to solve. A lot of infrastructure funding for solar and renewable energy, a lot of infrastructure funding for trains, because like me, Joe Biden loves trains, and they are the best way to move. So, the things that should be funded, however, the major changes that need to occur, obviously we need to shift to renewable energy. Obviously we need to phase out fossil fuels. It's not happening fast enough. And by the way, electric cars are not the answer. Trains are, but electric cars are not the answer. The electric cars are just, moving the problem to the source. And most of the power that powers electric cars is still made with fossil fuels. Not to mention the fact that electric cars require lithium, which is a finite resource. So until we have batteries that are not lithium based and don't go into indigenous lands to get that lithium and destroy those lands, or take land from countries like Bolivia and Ecuador, or we're not solving that problem. So the things that in fact should be funded, a better dietary regimen for the entire country. Michelle Obama is championing it, but there isn't enough money behind it. If everybody shifted to a vegetarian diet, or mostly vegetarian diet, we would reduce our carbon footprint enormously. But there are huge lobbies behind the opposition to this. So that's one thing that I think can change. It could be worse, but I think we're on. We've turned a corner, at least in the way we think about it, if not in the way we act about it. The other major problem is that most of the emissions are not going to come from the United States in the next 10 years. Most of the emissions are going to come from developing countries, particularly India, China, and the African continent, which are the most populated. That's more than half of the population of the world right there, those three. And it's getting really hot, particularly in India, and Africa, obviously, also. And only about 6% of India is air conditioned. So that's 96% in the United States. 96% of the United States has air conditioning. So can you imagine, as India, which has surpassed China in population, more than 1 billion, starts air conditioning their entire population, what the demand on power is going to be? And India is mostly coal powered. So the question that was asked, what are we doing to fix things? Well, we should start doing those things elsewhere and helping those countries actually skip the fossil fuel development that we have had and go directly to solar or other renewable. But I'm afraid that the hunger for riches and Western style lifestyle is so pressing that we're not going to really convince anybody that that's a solution.
Thank you so much for that. Honestly, I personally care a lot about sustainable development. I think is extremely crucial that sort of the US actually as well as the European Union to take the leadership position and to lead the world into a kind of a development where basically we're starting on basically leveraging those renewables already, so that basically our planet as a whole can find a way out essentially before we exhaust our resources and makes everything irreversible from there. Yeah, thank you so much. And there's an interesting question in the chat actually. How do you think we could use AI to positively impact climate change and global health outcomes? And how, I guess, how have it been playing in place?
AI?
Yep.
I'm not sure that it is yet. In the future. So what does AI do? Well, it does computational tasks that humans take too long, that would take too much human power to do, and would cost too much, and they're automated. I am not sure that we are at a point where AI can really find solutions to problems. Maybe in the future, but not right now. Still hallucinating a lot. But one thing that where AI could help probably, and it's been applied already to this, is analyze daily emission data from satellites, from essentially agencies that are government agencies, to see if what the corporations that the industries that produce those greenhouse emissions are claiming, that is that they're emitting less, that they're producing fewer greenhouse emissions, if to check whether that's true or not on a daily basis. How do you have humans check on that for the entire planet constantly? Even if you have the images, even if you have the data from satellites, there is not enough manpower anywhere, not even in the US government, to do that. Most of the agencies that could do that and the US government are underfunded to begin with, have very few people in them. But AI could be put to work to do that. Maybe the United Nations could have such an agency checking on, although I don't think it's the best place for it. Private sector is probably the best place for it, in a nonprofit. So, if you could basically monitor methane and CO2 emissions daily and give warnings, after analysis of all this data through AI, and give, automated warnings, methane leaks in this area are coming out at enormous rate, go stop it, as opposed to having a pipeline that's burst and continues to emit for months before it's found, which was the case last year, I believe, in the North Sea, and similar things happen in the Gulf of Mexico all the time, and nobody detects it because who's watching? Who's got the time to watch? Who's got the eyes, the eyeballs to watch all of this stuff? So that's how AI could help.
Gotcha. So it's more so on the regulatory aspect. Definitely agree that like basically you can replace like the manpower that were supposed to be needed.
Yeah.
Yeah. Virtually like that. Yeah, that's how
Well,
you.
it's not so much replacing it. You know, a lot of people are scared of us being replaced by AI. I am not so much. I'm waiting for somebody to get me an AI script to reply to my emails. That'd be awesome. That learns from me. So it's like learn how I reply, and then read all of my replies and then reply to the emails. That'd be awesome. Yeah, no, ChatGPT is not doing it. I tried. It doesn't work. It doesn't sound like me. So like it can't really replace people, but it can do stuff that people just can't do.
Yeah.
The tedious stuff. You're not going to hire anybody to do emissions checks on the entire world
24/7. No, yeah.
24/7. It's just not going to happen. Nobody's got that capacity. It doesn't exist by eyeballs. Nor is it going to be accurate because people get tired. So it's just not. It's not possible. So I wouldn't see AI as a big monster that's coming and taking your job, particularly as nurses or physicians or healthcare workers. That's definitely not. Maybe as small time coders in Silicon Valley, yeah, that's probably what's fueling the tech recession in California, I would suspect. But don't
Yeah.
worry. For now, don't worry.
Yeah. We're not at a stage yet. Okay. So basically to conclude our session, I guess like one last question in address generically to the question in the Q&A box. I know we have plenty that are left. Like basically what are your suggestions, like one-liners toward pre-health students or like undergrad students at our level if they really want to pursue kind of a career that can have an impact in public health and like to guide people to maybe like the correct way for development?
I think one line would be always have a beginner's mind. The concept that comes from Zen Buddhism and basically means see all the possibilities. There's in the beginner's mind there are many possibilities, in the expert's mind there are few. And as you progress through your education, you will focus more on, okay, I'm more of an organic chemistry person, or I'm more of a physics person, or I'm more of a, I don't know. And as you do that, it's important to really develop your muscle and wherever you're strong, and you should do that without a doubt. Don't stop doing that, but also never lose sight of all the other opportunity and the possibilities that are in other disciplines that you can bring in your main backyard and your main bailiwick, main area of expertise, so that you can become really unique in combining your specific blend of disciplines, your specific blend of questions and concerns, and solve them in ways that nobody else can, because again, the reality is interdisciplinary, and only you know the question really well that you care about, and only you can find the answers by looking everywhere, not just your areas of expertise. So that would be my one-liner. Also, academia is an extended training in rejection. So the only people who make it are the ones who just develop a thick skin and keep going on the marathon. If you get discouraged because you got rejected, or you got an A-, or you didn't get a fellowship that everybody else got, or whatever, you didn't match with the residency that you wanted, you're not going to make it very far. So just keep going. And eventually things get easier. Trust me. Once you get to grad school, things get easier. And once you get started working, about year 5 into work, you're going to be like, wow, most people don't really know what they're doing. I actually do. And that's amazing. It's an amazing feeling that gives you so much confidence. And then you look back and most of those people also didn't know what they were doing. And I was so insecure thinking I didn't know what I was doing, but I actually did. So you all know what you're doing. Let me tell you from the other side, you all know what you're doing. Keep going. It's fine. An A-, B+, C+, not a problem. Just keep going. It's not going to matter in the long run. One thing that matters is stick to it.
Mhm. Gotcha. Yeah. Thank you so much again, Dr. Moore, for speaking at our conference today and sharing such an amazing presentation as well as all those insights during the Q&A session. Really appreciate your time. And yeah, just thank you so much.
Yeah, my email is in the chat if anybody wants to contact me. I don't know if everybody can see the chat. I'm assuming they can.
Yeah. So,
And I look forward to talking with you all. Thank you for having me. Have a great day.
you too. And for our participants, we're going to transition to our next session on a career in epidemiology. And